She calls herself a nurse who makes comics.
And I'm sitting here today because one day I just sat down and made a comic.
But now, M.K. Serwick is considered a pioneer in the field of graphic medicine, the use of comics to depict someone's healthcare experiences. Serwick made that first comic while working in an HIV/AIDS care unit in Chicago in the 1990s.
As a nurse, I found this sort of combination of very basic image and text in sequential fashion to be really helpful. So the first comic I ever made was absolutely out of necessity, and I started because I was just miserable and felt really grief-stricken and confused, and I had to go to work at 3 o'clock that day. This was like 10 o'clock in the morning, and I had to figure out some sort of intervention to help myself be present to my patients and kind of help clear my own mind. And this just, so I sat down and made what turned out to be my first comic, and it worked, and so I just kept doing it.
And, says Patty Brennan, the power of comics is useful not only for patients and caregivers, but for those who work with them.
Sometimes we use graphic medicine for training clinicians or for debriefing practitioners in the workforce. The pictures helping them to bring out the concerns, the multidimensional experience of interacting with people.
NIH software engineer Hong Yu attended a recent presentation about the new exhibit. He says the comics make it easier to understand difficult material.
A lot of the time I find myself struggling to make people interested in those technical stuff, and they're a way about introducing medicine stuff, which a lot of times also to people that don't have a medical background would find boring. They'll be able to illustrate things in a very interesting way.
This exhibit will be open to the public until January of 2019, and a traveling exhibition will visit 50 sites over the next 4 years. Jill Craig, VOA News, Washington.